Hey everyone, welcome to today's Deep Dives, and today we're tackling family planning access right here in the U.S. To guide us through this, we're using a couple of sources, a recent CDC report that just came out, and also a really interesting CNN article that has some firsthand insights from a clinic director. But before we jump into all that, why should you even care about this topic? Well, I'll tell you, this number shocked me. Only about 35% of women who are of reproductive age actually used family planning services last year.
That's a really interesting point because family planning is often seen as a cornerstone of reproductive health care. And the CDC emphasizes how vital it is for both individual and public health.
Yeah, you're right. And it gets me thinking that before we dig into why that number is so low, maybe we should clarify what exactly we mean when we say family planning services. It seems like one of those terms that people kind of throw around a lot but might not fully understand.
Oh, absolutely. I think that's a good point. So when we talk about family planning services, we're really looking at a pretty wide range of things like, different forms of birth control, emergency contraception, sterilization procedures, and even counseling and advice to help people navigate all those different options.
Okay, that makes sense. So let's go back to that 35% figure for a sec.
Yeah.
Why is it such a big deal that it's so low? I mean, the CDC reports seem pretty concerned about it.
Yeah, they are, and I think for good reason. The CDC points out that when people have easy access to family planning, it's linked to having lower rates of unplanned pregnancies. And we're talking about over 1.5 million unintended pregnancies every year in the U.S. alone.
Wow, that's a lot more than I would have guessed.
Uh-huh.
And I'm assuming those unintended pregnancies come with like all sorts of challenges for individuals and families.
You're exactly right. Think about the potential financial strain, the impact on things like educational opportunities, not to mention the health implications for both the mothers and babies involved.
Yeah, it's a really important point, and it makes the CDC's focus on family planning seem even more critical.
Absolutely, and it's not just the overall low numbers that are concerning. The report also digs into some disparities in access to these services.
Yeah, the CNN article mentioned that too,
Yeah,
especially when it comes to things like different racial and socioeconomic groups.
exactly. When you look at the data, white women have higher rates of access to family planning services compared to Black and Hispanic women. And then the disparities continue when you add in things like income and education levels. It's like the more resources you have, the easier it is to get these services.
So it's not just a matter of access in general, it's equal access. Why do you think these disparities exist? Is it as simple as affordability, or is there more to it?
Oh, it's definitely not a simple issue. There are a lot of factors at play. Affordability is part of it for sure. But you also have to think about systemic barriers like lack of health insurance or even just transportation difficulties, actually getting to those appointments in the first place, and even just limited access to quality health care in certain communities.
Right. And it's probably hard to separate those practical things from like cultural and societal factors too. I mean, different communities might just have totally different views on family planning and contraception.
Right. You're absolutely right. Those cultural nuances are really important to consider. They can significantly impact how people feel about seeking these kinds of services.
That makes a lot of sense.
Yeah.
And speaking of barriers to access, we can't ignore the elephant in the room, the legal landscape after Dobbs.
Right. That's a huge piece of the puzzle. And the CNN article really highlights how the overturning of Roe v. Wade has created a lot of uncertainty and fear, even though family planning services are totally different from abortion.
It makes you wonder if there's this like chilling effect happening, where even if people know that these services are legal and available, they might still be hesitant to seek them out just because the whole reproductive health landscape feels so uncertain right now.
And there's actually research that supports that idea. Studies have shown that in states with the strictest abortion laws, women have become less likely to get prescription birth control. So even though they're different, the legal changes around abortion seem to be impacting family planning access, too.
It's like this ripple effect that goes way beyond just the issue of abortion itself. And I think the article really brings that to life, that story about the clinic in Alabama.
Yes, the story about Robin Marty, who's the executive director of WAWC Healthcare, is so powerful.
Yeah.
Because it gives you this on-the-ground perspective.
It was interesting how her clinic had to shift away from providing abortions and focus more on family planning services after Dobbs. But even that hasn't been easy.
Right, they're dealing with so many obstacles. One of the biggest is serving patients who are uninsured, which I'm sure is a problem for lots of clinics. These patients often can't get abortions or contraception.
So it's like a double whammy.
Yeah. Exactly. And what's happening in Alabama reflects this bigger trend happening nationwide. It's the rise of what some people are calling family planning deserts. And the article mentioned this report from the Abortion Care Network that found that so many clinics have either closed or stopped doing abortions since Dobbs.
It's heartbreaking because it means that even in places where those services are technically legal, access can still be super limited if there just aren't enough resources to meet the need.
That's exactly right. It just underscores how complex this issue really is.
It can feel overwhelming, honestly. But are there any reasons to be hopeful? The article did mention some positive developments, like new types of birth control and some potential policy changes on the horizon.
Yeah, there are, and it's not all doom and gloom. There are actually some exciting new things happening to expand access to these services.
Yeah, like Opal,
Right,
which
Opal.
is like the first ever over-the-counter daily birth control pill. It feels like a total game changer when it comes to access to contraception.
Yeah, it really is.
Can you tell us a bit about like how it works and why it's such a big deal?
Sure. So a pill uses a hormone called progestin, which basically prevents pregnancy by stopping ovulation from happening. And the big deal is it's available over the counter, so people don't need a prescription to get it. That's a big barrier removed for a lot of women.
Makes sense. Especially for people who have trouble accessing health care for whatever reason.
Yeah.
And it seems like there's some promising stuff on the policy side, too.
Yeah, the Biden administration actually proposed a rule that would require private insurance plans to cover over-the-counter contraception with no out-of-pocket costs for patients. So if that's implemented, it could be a huge step towards making birth control more affordable.
Wow, that's amazing. So it sounds like there's some positive things happening, but I imagine there's still challenges, right?
Of course, there are always going to be challenges. One thing that keeps coming up is the funding issues with Title X.
Oh, yeah. Can you remind us what Title X is exactly and why the funding is so important for family planning?
Absolutely. So Title X is a federal program that's specifically designed to help people get family planning and preventative health services. It's been around for a really long time, and it's been super helpful for low-income people and people without insurance. Unfortunately, it's run into some funding problems over the years.
Yeah, I remember hearing about how the Trump administration had all those regulations that impacted Title X. Has that gotten any better?
It has to some degree. The Biden administration actually reversed those regulations, which was a step in the right direction, but it hasn't totally recovered yet.
So 2 steps forward, 1 step back kind of thing. It makes sense. Progress is rarely like a straight line,
Hmm.
especially when it comes to these kind of politically charged issues like reproductive health.
Exactly. We have to stay realistic and acknowledge that these challenges will probably keep coming up. But it's also super important to celebrate the wins and keep advocating for change.
Absolutely. And it's really inspiring to see clinics like Robin Marty's,
Hmm.
doing this important work, even though there are all these challenges. They're really on the front lines of this whole fight for healthcare access.
They are, and their story shows how important trust and support from the community are, especially in places where care is so restricted or there's a lot of stigma around it.
It makes you realize that family planning is about way more than just preventing pregnancy. It touches on social justice, equity, and individual empowerment.
You're right, it really does. At its heart, it's about giving people control over their own bodies, their lives, and their future.
So powerful. So we talked about a lot here today. Access issues, those disparities, the legal side of things, and even some hopeful developments. But as we wrap up, I want to zoom out a little bit. Why is family planning so important for our overall well-being, not just our reproductive health?
That's a great question because it really does go beyond just preventing pregnancy. For a lot of women, especially those who don't regularly see a doctor, family planning services are often the main way they get into the healthcare system.
So it's not just about reproductive health by itself. It opens the door to broader healthcare access.
Right. And when people go in for family planning, it creates this opportunity for other things like health screenings, preventative care, and counseling on a bunch of health issues they might not have addressed otherwise.
It's like a crucial entry point where you can catch things early on and offer more well-rounded care.
Exactly. And when you have that control over your reproductive health, it can impact so many other areas of your life in a positive way.
It makes sense. If you're not constantly worried about an unplanned pregnancy, you can focus on other things like your career or your education or your personal goals.
You get to shape your life based on your own values and goals.
So powerful. It really is all about empowerment.
I couldn't agree more.
This has been such a great conversation. Thank you so much for walking us through all of this. As we end, I want to leave our listeners with something to think about. How can we make sure everyone has equal access to these important services? There's no simple answer, It's going to take a lot of different approaches, but it's a conversation we have to keep having.
Absolutely. We need to think about those systemic barriers, challenge any biases that might be out there, and advocate for policies that put equity and inclusion first when it comes to healthcare.
Well said. So to recap what we talked about today, we learned that access to family planning services is surprisingly low in the U.S., and the differences between different racial and socioeconomic groups are pretty significant. We also talked about how the Dobbs decision has created a lot of uncertainty, even for services that aren't directly related to abortion. And while there are challenges, there are also some really promising things on the horizon, like having over-the-counter birth control and some policy changes that could help more people afford the care they need.
It's a mixed bag for sure. But I think the big takeaway is that family planning is about so much more than just preventing pregnancy. It's about giving people the power to make their own choices about their health and their future. It's about building a society where everyone has the chance to thrive, no matter what their background is.
Thanks for joining us on this deep dive into family planning access in the U.S. If you want to learn more, we encourage you to check out the resources in your own community. There are so many great organizations and advocates doing amazing work in this area. And keep talking about this with your friends, family, and colleagues. The more we talk about it, the closer we get to making healthcare more just and equitable for everyone.
And don't forget reproductive healthcare, IS healthcare.
Until next time, keep learning, keep asking questions, and keep the conversation going.